I am a Yale School of Management alumna, and as the founder of Hub 55, a company that supports and works with Yale University on Brazil-related efforts, including with the Council on Latin American and Iberian studies, I am delighted to welcome you to today's career conversations with another Yale SOM alumnus, Ricardo, who is based in Brazil. Let me start talking a little bit about the Council on Latin American and Iberian Studies. The Council enhances the understanding of Latin America and the Iberian Peninsula through collaborative efforts focused on meaningful partnerships and exchange of ideas and academic research. The Council is the central hub for intellectual exchange and partnerships in Latin America, Spain, and Portugal, and it also administers the Latin American Studies undergraduate major. If you have not yet officially joined the undergrad, or if you're a graduate student, please visit the Council website to join. And then you will be part of our close community, and we'll have opportunities to meet with and work with our faculty and visiting scholars, as well as funding opportunities during the academic year for short-term research, travels, conference, as well as summer projects. We are pleased to have Yale and US college students as part of this network, and we are delighted to be collaborating with the Jackson Institute as part of the Career Conversation series. Now, I'm very glad to be introducing our guest speaker today, Ricardo Joseph, who is joining us from Brazil and has worked throughout Latin America too. Ricardo is the COO and co-founder of Vibe Saúde, the #1 health digital platform in Brazil. Vibe Saúde focuses on health management, health habits, and wellness programs. Previously, Ricardo was a senior consultant for various companies, including PwC and Grupo Ultra. He has also founded other companies, including several, a social media app and a grocery delivery service. Ricardo received his BS in product engineering from University of São Paulo in Brazil and his MBA from Yale School of Management. I personally still remember the day I've met him, and I was just arriving to campus to do my master in advanced management, and he came to his reunion, and he was so caring and encouraging, and I'm so happy to have him now today to share everything with you. So with that, thank you, Ricardo, and welcome.
Thank you, Pamela, for your nice words. It's a long time, right? From the last reunion. Thank you, Asia, also for inviting me. Well, given that we are in a small group here, I want to be very, well, as I said before, we are in Brazil, so we are used to people arriving late, no problem. We are in a small set of people, so I want to be informal. I want to say something about my current business, Vibe Saúde. I think that's the main point that you are interested. But feel free to ask and jump in to take your doubts, and then we can have this free chat, very informal. So I haven't prepared any major presentation because I think what we have to say here, it's simple. Health, it's one of the latest industries that is being affected by the digital world, the digital economy. Health, it's very complex. It's a very complex value chain industry because there are several players, stakeholders involved. So we have like doctors, labs, and hospitals, and HMOs, and many times here in Brazil, and I guess also in the US, private employers offering a health plan. So and this generally they are not in only one umbrella, right? They have probably different interests, and many times they are in conflict. And this is one of the issues of why health, the coordination of health, it's an issue, it's a problem. Here in Brazil, it's the same thing. Of course, we are a not so poor country, but very unequal country, and with 212 million inhabitants population, and only 47 have a private health insurance, a health plan, and 160 plus rely only on the public services. We do have a public service with an architecture very good, working with primary health, but it's underfunded, has corruption and no good availability, access to the majority of the users. The country is also large, big as United States, and many times the doctors are concentrated in the larger capitals. So São Paulo, Rio de Janeiro, and so on. So that's to give a little bit of context. Health techs are growing now. They are receiving lots of investments from VCs and private equity. There was a major M&A in the US with Teladoc and Livongo. I'm not sure if you're aware, but it's interesting to mention them because Teladoc, it was mainly a transactional telemedicine company. Like, I want to talk to a doctor right now, so and then I call, and then I have my consultation and prescriptions after the consultation. And Livongo had another approach of a long-term care where you would have like digital therapeutics programs, like six to 12 months or even more, to take care of chronic conditions like hypertension, obesity, or diabetes. But and then they joined because I think the major trend is telemedicine itself. It's going to be a commodity. Many HMOs, insurance plans have like a kind of WhatsApp or Skype type of video call system. And this is no big deal in terms of technology, right? But I think that the major point is to establish a connection with the user, with the patient throughout the time, to take care of the user, not only chronic, of course, demands more care, but the idea is to work, to be with the user along the journey, and also promoting not only taking care of the diseases, but promoting health. So encouraging with gamification and incentives, the people to walk more, to exercise more, to eat better. So we have this kind of solutions, functionalities in our solution. So in our platform, we not only provide a telemedicine on demand, we also have these programs along the time, promoting the primary care, and then not going directly to a specialist or not doing an exam without one main doctor that will continuously knows your context, your family, and then guiding you throughout the health journey. And also all this contents and challenges and incentives in order to give you to try to give you to send you to a good path of good habits. And of course, this is very difficult engagement. It's not an easy task. I always say that Pokemon Go was one of the most successful stories of engagement, but after, I don't know exactly data, the figures, but after 1 to 3 months, the engagement that spiked to 50 some millions of users, then fell absurdly. So in the end, yeah, I think nowadays in our modern lives with notifications and stimuli all the time, it's hard, and the life in cities also, and it's a challenge to be in a good track of good habits. So I guess that's the main point. What we are doing, we decided one important thing. We decided to go with the freemium model. So because we were a new brand with no major with no major brand itself. So we decided to look. Let's start offering consultations for all these 160 million users for free. And then after a certain period of time, we're going to start trying to convert these users / patients into signatures. So similarly, what Spotify and other services have done in the past. So the user will have 5 consultations, maybe 4 in the future for free. But if she decided to sign for a subscription plan, he would have like better SLA, no limitations, and some discounts when you're talking about having a consultation with a specialist, with a continuous therapy, and so on. And some discounts when buying prescriptions, doing exams, and so forth. And well, in general, that's what we're doing now. We raised a Series A investment in January. Because we are doing this model of freemium, we are investing in customer, user, patient acquisition. We have our own team, our own professional technical team. So psychologists, doctors, nurses are all within our company, and this is very important to guarantee quality, standardization of procedures. And what we see in our Play Store, that's our main base of users here, of C-class, middle class here in Brazil. It's an amazing return of quality, of perception, of how the service is well received. Of course, it's free. Of course, pandemia was a major factor to help us boost this moment. And I think just to complete here my introduction is we are running for a Series B. We want to expand. We reach around 1,200,000 downloads. We are serving like 40 to 45 monthly consultations, and we plan to have like 10,000 consultations per day by the end of the year. Today we have almost 90 to 100 professionals. By the end of the year, 300, and in 5 years, 5,000. So we are a health company, but served by technology. So technology, of course, it's very important, but we are first a health company.